Oranges represent the archetypal vitamin C source in most people's minds, and this reputation is well-deserved from a gout management perspective. A single medium orange provides approximately 70 milligrams of vitamin C, and larger varieties or multiple fruits can easily meet or exceed the daily recommended intake. This ascorbic acid content translates directly into therapeutic benefits for hyperuricemia. The mechanism connecting vitamin C to uric acid reduction centers on renal handling. Vitamin C and uric acid compete for the same reabsorption transporters in kidney tubules. When vitamin C intake is high, more of these transporters are occupied with ascorbic acid, resulting in less uric acid being reabsorbed back into the bloodstream and more being excreted in urine. This competitive inhibition provides a natural way to enhance urate clearance. Clinical trials using vitamin C supplementation have demonstrated measurable reductions in serum uric acid levels. While oranges cannot provide the superphysiological doses used in some studies, regular consumption contributes meaningfully to overall vitamin C intake. The food matrix of whole oranges may also provide enhanced absorption and utilization compared to isolated supplements. Potassium content in oranges supports kidney function, which is central to uric acid elimination. The kidneys filter approximately 90% of the body's uric acid daily, with most being reabsorbed and a portion excreted. Optimal kidney function depends on adequate hydration, appropriate blood flow, and electrolyte balance. Potassium helps maintain these conditions. The water content in oranges contributes to overall hydration status, a critical yet often overlooked aspect of gout management. Adequate fluid intake dilutes uric acid concentrations in both blood and urine, reducing the likelihood of crystal formation. The combination of water, electrolytes, and vitamins in oranges makes them more hydrating than plain water alone. Flavonoids in oranges, particularly hesperidin and naringenin, have documented anti-inflammatory and antioxidant properties. These compounds work synergistically with vitamin C to reduce oxidative stress and modulate immune responses. While research on citrus flavonoids specifically for gout is limited, their general anti-inflammatory effects support overall inflammation management. The fiber in whole oranges, primarily soluble pectin, slows digestion and supports stable blood sugar levels. This is crucial because the fructose in fruit can be problematic when consumed in liquid form without fiber. Whole oranges release their natural sugars gradually, avoiding the insulin spikes associated with juice consumption. The distinction between whole oranges and orange juice cannot be overstated for gout management. Orange juice, even when pure and unsweetened, delivers concentrated fructose without the moderating influence of fiber. Fructose metabolism generates uric acid as a byproduct, and excessive fructose intake from any source can actually worsen hyperuricemia. This is why whole fruit is strongly preferred. Fructose-induced hyperuricemia occurs through several mechanisms. Fructose metabolism in the liver depletes ATP and generates AMP, which is broken down to produce uric acid. This process is rapid and significant, with high fructose intake causing measurable uric acid spikes. The fiber in whole fruit slows fructose absorption, minimizing this effect. Multiple large epidemiological studies have found that while whole fruit consumption protects against gout, fruit juice consumption increases risk. This paradox is entirely explained by the fructose-fiber relationship. Whole oranges provide protective vitamin C and other nutrients while delivering fructose in a controlled, fiber-modulated manner. Orange segments contain membranes rich in pectin and other beneficial fibers. Eating the entire segment, including these membranes, maximizes fiber intake and nutritional benefits. The bitter white pith, while less palatable, contains additional flavonoids and fiber. Consuming oranges rather than carefully peeling away all non-flesh parts provides optimal nutrition. Seasonal variation in orange quality and availability affects nutritional content. Peak season oranges have higher vitamin C levels and better flavor. When fresh oranges are unavailable or unaffordable, canned mandarin oranges in water or juice provide an alternative, though fresh is always optimal. Organic versus conventional oranges show minimal differences in nutritional content relevant to gout management. The vitamin C, potassium, and fiber content are comparable. Pesticide concerns are minimized by the thick peel that is typically discarded. The choice between organic and conventional can be based on personal preferences and availability. For individuals on certain medications, particularly some blood pressure drugs, citrus consumption requires consideration due to potential interactions. However, these interactions primarily concern grapefruit, not oranges. Still, patients on multiple medications should verify that citrus consumption is appropriate for their specific medication regimen. The portability and convenience of oranges makes them practical for consistent consumption. Unlike some therapeutic foods that require preparation, oranges can be eaten anywhere, supporting dietary adherence. This practical aspect should not be underestimated, as the best dietary intervention is one that patients actually follow.